Hello, Brenda. My name's Irina. I'm a psychiatric nurse practitioner. Nice to meet you. I'd like to discuss two medications with you that are used for the treatment of bipolar disorder. The first one is olanzapine, brand name Zyprexa. It's an antipsychotic medication that is used for the treatment of schizophrenia as well as bipolar disorder. The second medication is lithium. It's not an antipsychotic. It's actually a mood stabilizer, and it is FDA approved for the treatment of bipolar disorder. Some benefits of Zyprexa is you only have to take it once a day. It has a very low risk of heart irregular rhythms, and a big one especially for you since you want to get pregnant. It is actually safe to be taken while pregnant. Studies have shown that it does not increase the risk of any fetal malformations. Some risks of Zyprexa is metabolic dysfunction and insulin sensitivity, and it also poses the risk of extraparietal symptoms and motor movement disorders such as tardive dyskinesia, where you're having uncontrolled body movements. A lot of clinicians still believe that lithium is the golden standard for treating bipolar disorder. Lithium also has neurodegenerative properties, so it can help prevent neurodegenerative diseases and even dementia in the future. The biggest downfall of lithium is it takes a while to start working. It can take weeks to even months. It also has a very neurotherapeutic index, meaning that even a slightly elevated concentration of the lithium can cause toxicity. Lithium also should not be taken while pregnant. If you take lithium while pregnant, it can cause there's a significant increase risk of fetal malformations, particularly heart malformations. Okay, so now we'll talk about the side effects associated with each medication. So the most common side effect of Zyprexa is increased appetite, which subsequently leads to weight gain. 10 to 30 pounds is pretty common with Zyprexa. Other common side effects is drowsiness, constipation, dry mouth, dizziness, headaches, and blurred vision. In rare instances, a dangerously severe drug reaction called DRESS, which stands for drug reaction with eosinophilia and systemic symptoms. It starts off with a fever and a rash, and then it proceeds to enlarged lymph nodes and facial swelling. If you do experience that, stop immediately and go to the emergency room. Common side effects of lithium are nausea, diarrhea, slow heart rate, memory issues, tremors, increased urination, increased thirst, hypothyroidism, and acne. Increased white blood cell count is also possible with lithium. Long-term use of lithium can also cause aplastic anemia and kidney impairment. Both Zyprexa and lithium require monitoring. With Zyprexa, you would need glucose and lipid monitoring, and then with lithium, before we even initiate lithium treatment, we would have to do kidney and thyroid function tests as well as a weigh-in. These tests, along with the weigh-ins, will have to be done every once or twice a year. And because of its narrow therapeutic level, lithium levels will have to be checked every 2 weeks until we reach a therapeutic level, and then after that, every 2 to 3 months, just to make sure we stay within that narrow therapeutic index. Okay. Of the two medications, I would recommend Zyprexa. The main reason is lithium should not be taken when pregnant, as I mentioned before. And I think right now, during this acute stage of mania, stabilization is essential. Lithium takes a while to kick in, weeks, even months. Zyprexa comes in oral and intramuscular injection form, and the intramuscular injection can work as soon as a half hour after administration. Also, you are on Prozac or prescribed Prozac. It's okay to take Prozac with Zyprexa, but it is not recommended to take Prozac with lithium. Lastly, even though both of them require monitoring, lithium requires more intense monitoring compared to Zyprexa. What are some of the questions or concerns you have about these two medications?